Welcome to It's Your Health. Virginia Jane and I are happy that you're with us today. We have so many different topics that... Oh, and Dr. Benyo's with us too. He's joining us. Do you want to tell them what we'll do today?
After this brief commercial message, remember you're watching It's Your Health, your leader in healthcare information. We'll be right back. Welcome back to the first edition of It's Your Health.
He meant the first section. He meant the first part. He meant we're just beginning, and then there's going to be 2 parts after that. He didn't mean the first edition. We've been doing this for many, many years, so it's not really the first edition, but go ahead.
Welcome to the first segment of It's Your Health. It is the fastest 30 minutes in television history. I'm here with my bride, if you can't tell, and of course there's Virginia, who is our mascot. We have a whole host of things to go over. It was a quick winter, a mild winter. We're almost into spring. Okay, I'll be quiet. You think I'm at home here, but go ahead.
Eating more than 2,000 calories a day may place seniors at a high risk. Older adults who ate between 2,000 and 6,000 calories each day were twice as likely to develop memory loss.
Yeah, it's one of those things where they've actually done studies, and if you can lower your caloric intake, believe it or not, you will live longer with less problems. You may not necessarily live happier longer, but nevertheless, by cutting down on calories, a lot of good things happen. And of course, the opposite is true. By eating more calories than you need to, especially when you're older, tends to bring on problems earlier.
Wow, that's amazing. It affects your brain.
Mm-hmm.
Next one. Married seniors with a regular sex life are more likely to be happy.
Is that us? Are we? What segment of that are we?
We are not seniors.
Oh, okay.
We do not get a senior discount yet.
I see. All right.
The more often older people have sex, the more likely they are to be happy with their life and enjoy a good marriage.
Well, that's kind of like a no-brainer, is it not?
Yeah, but see, they're talking about people who have sex once a month.
I see.
Being happy.
Oh, okay. I don't know if I could handle that.
That's exactly my point. Next one. The ugly truth about your toothbrush. Your toothbrush is loaded with germs, more than 100 million bacteria. You don't keep your plates and glasses next to your toilet, so you also shouldn't keep your toothbrush there either. You wouldn't eat after going to the bathroom, so you should wash your hands even before you brush your teeth. Those are all common things, but we didn't grow up that way. We grew up with our toothbrush being right there at the sink.
Right, and studies without question have shown that when you have bad teeth, you have bad other health problems following right behind, particularly heart disease. So good dental hygiene, and we don't really stress that enough for all segments of our population. You really need routine dental health care.
I think that's happening. When I was much younger, you didn't go to the dentist unless something was wrong. You didn't go for checkups.
Right.
Did you?
You're correct. You went when there was a problem, and now it should be more preventative in nature.
And I think it is. Customers would opt for smaller portions if restaurants gave them the option. So if you were at McDonald's and they said, "Would you like a smaller order of fries with that?" they claim that people would say yes. I claim that this is baloney. Well, French fries.
Well, that's, you know, when you're hungry, unfortunately, what happens is that when you start eating, it takes at least 20 minutes for your stomach to get full and distended and tell your brain that you're no longer hungry. So who eats a meal in 20 minutes today? It's just impossible. So everybody's wolfing down their food and they're still hungry, and there's no wonder, is because they haven't given their body time enough to tell its brain that you're no longer hungry.
Well, they did a study with people who took smaller portions of carbohydrates, I guess. They certainly cleared their plates, but so did the people who took the regular amount of carbohydrates clear their plates.
Yeah, it's a big problem. It's an epidemic, and I don't know what the answer is.
Me neither. But we've been talking a lot about weight and general health. What can you tell us about all these diets that are out? There must be hundreds of them. When you go in the bookstore, there's a whole section of just that.
Well, I think what works the best, if you take a page from the Alcoholics Anonymous, and if you're an alcoholic, trying to stop drinking is a major issue. It's a compulsive behavior. It makes you feel good, if you will. And so Weight Watchers takes a page from Alcoholics Anonymous in terms of having regular meetings, having people around you with the same problem who tend to share the load. And Weight Watchers, I think, is one of those things that help. We used to say anything white was no good, to give up the carbs, and that includes potatoes, white breads, for example, pastas. So it's staying away from the white things. But who wants to do diet and exercise today? No one has the time. Everyone feels tired. We're all working 18-hour days, if you will. At least I am.
Well, what about the DASH diet? That's gotten a lot of play for bringing down high blood pressure, lowering your cholesterol.
Right. Maybe you could tell us a little more about it.
Well, it's the DASH diet, dietary approach to stop hypertension. And that's its primary goal, is if you have high blood pressure or other issues related to that, it was the best plan.
The DASH diet.
The DASH diet. And then Weight Watchers was the best plan to lose weight. Just as you said. You were exactly correct. Just wanted you to know that.
Right, and people who buy those diets that they get delivered to them work on that glycemic index, and if you were to Google the glycemic index, you would find out what foods are bad for you. For example, there are good foods and bad foods, and that will give you a range of foods that you shouldn't even have around your house.
And I'm sure we don't have them around our house, like ice cream, never. Okay, you had mentioned earlier, we were talking about the toothbrush, and you talked about that it could affect your whole system. Tell us more about gum disease.
Well, again, it falls in line with dental health. And when you have inflamed gums, again, that's an index of inflammation. That index of inflammation can affect other parts of your body. Hypertension, heart disease, diabetes, can lead to infections. And when you start losing teeth, that is another sign of a decline in your health. So again, you would want to have a regular dental checkup. And if you have sore gums, bleeding gums, loose teeth, by all means, start the slow process of getting these things in order.
Speaking of which, if your gums bleed when you brush your teeth, that is not normal. It's like my doctor, dentist, said to me, if you rub your eye, does it bleed? It shouldn't, and neither should your gums. We're going to take a break now and rest our gums.
Okay, we'll be right back after this brief commercial message. Remember, you're watching It's Your Health. We're your leader in healthcare information. We'll be right back. Are you bringing us back in?
When is our wedding anniversary?
Oh, God.
No, God knows.
It happens once a year. I know that.
Okay. When is my birthday?
That happens once a year, too.
You've made my point.
What's that?
Mild memory problems are more common in men.
Oh.
Men may be more likely than women to experience mild memory or cognition problems. The condition often comes on before you get dementia.
I see. Okay. Well, it's in February. That's sometime when we were married. And in April, you had your,
okay, birthday. So just talk about the article. You've already, you're already past that. You already lost.
Well, it's funny you mention that, because the brain, if you don't use it, you lose it. And this is an indication where you might consider getting some puzzles, if you will, or doing things to help exercise your brain, crossword puzzles.
Listening to your wife when she speaks, remembering what she tells you. When you go to the grocery store, buying what she says she needs and not what you feel like buying. Oh, there's lots of ways to increase your memory.
Is this where I say I never met a man with so many faults? Is this, that's what comes to mind.
Allergy pill Allegra, I'm changing the subject, to be sold over the counter. The FDA today approved over-the-counter sale of Allegra, the best-selling antihistamine.
I love Allegra. It's non-sedating, generally does not affect the pulse, blood pressure, well tolerated, generally low incidence of drug interactions, not a heavy-duty decongestant. But I'll tell you what I like and what I take for myself, which works terrific. And I know it sounds crazy out there, but I use Children's Liquid Dimetapp. I get that bottle for $4 or $5. Children's Liquid Dimetapp, cold and sinus, and I take the 6-year-old dose. Dries up the sinuses, gets rid of cough, congestion, doesn't affect your pulse, blood pressure, or prostates for that matter. Doesn't make you stunad. It makes you sleep,
me what?
sleepy or drowsy, because you're taking a 6-year-old dose, and it's just
Well,
enough.
how come you never told this to me?
I think I forgot. It's part of my memory issues.
Probably did. Okay, we're up to a new herb, a Chinese one that targets the immune system. A new discovery about a 2,000-year-old Chinese herbal remedy derived from the roots of the blue evergreen hydrangea may pave the way for a new generation of targeted treatments for autoimmune disorders, such as rheumatoid arthritis, multiple sclerosis, and psoriasis.
It's interesting, when you look at most drugs, they do come from plants or yeast or fungi or things like that. So I'm not terribly surprised. I would be careful. Any of these supplements can interfere with medicines you're already on. It could cause side effects. So you got to fly it past your doc. As we always say, give me the brown bag. Everything that you're taking, put in a brown bag and bring it to us so we can sort through it and hopefully keep you out of trouble.
Well, people usually think that you mean only prescription things.
Right.
But you don't mean that.
Correct.
You want their vitamins, you want the herbs they're taking, that's all included.
All part of it, yes. Yeah, bring them all down, because some of them can interfere with prescription drugs.
Okay. Next, we're going to... Virginia has left us. I hope she's not suffering from dog diarrhea.
That's a problem.
Yes, especially if you have to clean it.
Especially if who has to clean it?
Me. Okay. I have to clean it because he forgets.
Oh, okay.
There's lots of reasons that your dog can get diarrhea, and it could mean absolutely nothing. You want to keep an eye on your dog, make sure that they're drinking. Don't worry if they're not eating. They can go without eating for a while, but if they're not drinking, you need to contact your doctor. Otherwise, let them go and do the best you can. If you can get the little potty pants to put on if the diarrhea is bad. If you see any blood, that changes the whole picture. But it could be a change in food. It could be a lot of different things. And dogs eating grass does not necessarily mean that they're sick. People believe that old wives' tale, if a dog is eating grass, the dog is sick. And that's not necessarily true. Some of them eat grass just because they like the taste of it.
Huh, I didn't know that. I thought it meant they were sick.
No. But the best thing to do is make sure, just like regular checkups at your dentist, that your dog gets her regular checkup, so she gets all of her vaccinations, and that will help to take care of almost any problem that your dog has.
You heard it first on It's Your Health.
I'm only too happy to help. But this is a serious one that we're on next. And the question was called in, what is bipolar disorder, and how can you describe that in a minute?
Well, we're going to start seeing more and more of it with the change in seasons. Bipolar means, just like there's a North Pole and a South Pole, there's two different aspects to your personality. You can obviously be depressed, don't want to leave the house, don't want to interact, don't want to take care of yourself. And then there's a manic phase to that where you go gambling and make poor decisions and kind of just are wild, can't sleep.
Go shopping, spend lots of money that you wouldn't normally spend. I mean, I mean, manic is really more than just having energy. Did you want me to go over any of these questions, or do
Sure.
you know them all?
I don't know if I know them all, but
Okay.
I'll try.
If you have dramatic mood swings, lots of energy, then hopelessness.
That sounds like a bipolar disorder.
I sometimes feel much more confident, talk more quickly, or am more outgoing than normal.
That could be part of that manic phase.
Yep. Oh, I'm agreeing with him, like, I know. I worry my mood swings are so intense they affect my work or my relationships.
Now that sounds like you, but go ahead.
Well, that sounds like bipolar.
Oh, okay.
I have had episodes of impulsiveness, like shopping sprees, that spending a lot of money up at the mall on shoes.
Yeah, that's part of.
Okay, let's go to the next one. Okay, the next one that we have to talk about is RLS. I don't even know what RLS is.
It might be restless leg syndrome. Do you think
Okay.
that sounds?
That sounds right.
Yeah,
it fits.
We're seeing more and more of restless leg because we're asking patients about it, and like the name implies, it's a condition where your legs are restless. You don't know where to put them. Sometimes they might have painfulness and burningness. Usually we would see that more in a diabetic. More in the evening, by the way. The restless leg we don't see as much during the day, but at night the legs become restless, sleep disorders, people become moody and irritable.
Okay, I'm becoming moody and irritable and restless, so I think it's time to take a break.
Okay. Our second segment of It's Your Health, again the fastest half hour. We'll be right back after this brief commercial message. It's Your Health, your leader in healthcare information and dog information as well. Welcome back to the third and final segment portion
Well done.
of
He remembered.
It's Your Health. And I told you it's the fastest 30 minutes in Hazleton, so the greater Hazleton area, I guess, because we go all over now, right?
I guess. Okay, well, I'll get started then, acting serious and doing our...
As usual, yes.
This one's about people age 50 and older.
Okay, that's us?
That sure is.
Okay.
We can now get Merck's Zostavax shingles vaccine.
Oh, yeah, this is really something you ought to listen to out there in television land, and that is there's a vaccine which generally gets paid for to prevent shingles. Shingles is more common after the age of 50, certainly 60, characterized by a skin rash on one side of your body and can leave you with this painful, almost lifelong, what we call neuropathy, where the nerves are just burning and there's no relief. Some people actually end it all because they just can't stand this burning type of pain.
Does it go away? Can it go away?
It can go away, but sometimes it lingers. And we have patients out there that have post-herpetic neuropathy after getting shingles, and they're miserable. It's very hard to get rid of that pain after shingles. But the good news is it's kind of preventable. So you can get a vaccine that would prevent your getting shingles to begin with. So you really, really ought to look into that. That's probably one of the best vaccines out there.
You know what's interesting? I'll tell you what's interesting. You've never mentioned it to me.
Really?
Really? Did it slip your mind that maybe I'm barely over 50 and I should get this vaccine?
Now that you mention it, maybe you should look into that.
Are there any side effects?
Well, with all vaccines, you can get a sore arm. This is one of the safer ones. We generally do not see side effects from this.
Okay, here's one you'll like. The toll of high heels. An obsession with wearing high heels may take a toll on women's muscles as well as their pocketbooks. It changes the basic mechanics of how women walk even when they're barefoot.
Right. Podiatrists will stay in business forever because women like wearing high heels, and I think men like looking at women.
Absolutely.
So I don't know what to tell you, except you should really wear a lower shoe. It's kind of like putting a wrong set of tires on your car. Things are going to wear out a little quicker.
Did you notice this season, though, the heels are even higher than ever?
Now, if they wear them in bed, does this thing count, or it's just with walking?
Oh, my goodness. I'm going to the next question.
Let's go back to that senior.
Women
Okay.
may feel pain more than men do. Women may feel it more intensely, especially specific types of pain, such as musculoskeletal pain, osteoarthritis, neck pain. We feel it more intensely.
Did they say why?
I thought you knew why.
Oh, well, okay, I thought you knew why, but I'll tell you why. It's just the way it is. But no, that's one of the things that we see all the time, and that is, take for example fibromyalgia, painful muscles. I'll see 100 women who have fibromyalgia as opposed to one guy. And it has to do with your brain's ability to register pain. One of the interesting tests we have is when we take a blood pressure reading. The typical fibromyalgia patient, when we're pumping up the blood pressure thing, they'll go, "Ow, that hurts, that's too hard, that's too tight." And that's sort of a tip-off that this person might have fibromyalgia.
Oh, I was just thinking of the earlier comment about in bed.
Oh, which one
Never
was that?
mind.
Okay.
Let's talk about, go back to bathrooms again.
Okay.
We were there before. They measured high-touch areas such as the sink or the faucet where you dry your hands, and they found staph and E. coli, as well as several types of bacteria responsible for 2/3 of hospital-related infections. The researchers suggest carrying your own hand sanitizer, not even touching the door on your way out.
Right. Well, there's no doubt. There's germs all around us, if you will, and a lot of them are spread in that fashion by where your last handshake was or what doorknob you touched last. Hand sanitizers are great things to help reduce that bacteria load. And as in the hospital, when between patients, we're constantly washing our hands all the time so to keep the germs from being spread from one person to another.
Have you ever heard, or do you remember the phrase, spring ahead, fall back?
Yes, I heard that.
And what does it mean? What does it have to do with?
And we're not in the bedroom now, right? This is the clocks. I think the clocks are moving.
Yes, yes, clocks, and they changed it that they're moving earlier in the spring and later in the fall. So early in March, we're going to spring ahead an hour. Does that affect people very much?
Well, there's another old saying, which you may have heard, and that is crazy as a March hare. Did you ever hear that?
I did.
Okay, and what that means, as I alluded to earlier with the bipolar stuff, we are going to see more emotional issues come March. We see more anxiety, we see more depression, we see more ulcers, we see more problems with relationships. People get activated, and the same type of thing that's waking up a sleeping bear coming out of hibernation is affecting us. It's lighter earlier, it's lighter longer. Spring is a very activating agent, so if you are feeling a little antsy out there, it could be crazy as a March hare kind of as spring rolls around.
But I thought getting the extra sunlight is good. You know, they talk about the SAD syndrome, and now you're getting extra sunlight, so why are you crazy?
Well, not everyone's crazy.
It's just a select few that are crazy. Listen, well, let's try to get this one question in yet that someone called about. This woman is in her 30s, and she wants to know how she should know if her periods are abnormal. How would she know that?
Well, assuming she's premenopausal, the periods should be coming regularly on a monthly fashion. I guess you can have some spotting between them, not too unusual when you're premenopausal, but I think when you're talking about blood on an irregular basis from whatever cavity it is, that really warrants attention. So I would strongly recommend a gynecology exam. And you would be amazed at the number of women who we see who are clearly postmenopausal, and they have bleeding vaginally, and they kind of just chalk it up and don't say much about it. I mean, that really demands attention, so don't just wish it away. Make sure you get checking with your gynecologist or healthcare provider from irregular bleeding.
So you're talking about postmenopausal at this point.
Right.
I don't want to talk about that anymore.
Okay.
So let's end the show.
Okay. There it is. I told you, crazy as a March hare. It's coming around the corner. Thank you for allowing us to be part of your health care, coming into your home and entertain and hopefully inform you. Remember, it's your health, your leader in health care information. Right, dear?
Yes, dear. Have a wonderful spring.